Okay, I am starting. So if we could have some quiet for everyone else so we can hear. What comes to mind when I say the word extontia?
Accident.
Extractions?
Accident. Extraction.
Extractions. Extractions of what?
Extraction is wisdom teeth.
Wisdom teeth. Yeah, that's a big one that we extract a lot.
Yeah.
Wisdom teeth. What can happen with wisdom teeth?
It's the extra teeth.
Impacted.
Yeah,
Close.
impacted.
Impacted. Good. So they can be impacted.
They don't come through.
Yeah? So impacted means that there's not enough room and the teeth aren't growing up out of the gum. They're travelling like this. So a very cool case that I've seen in my career is we found a wisdom tooth about here. It had just kept travelling.
Really?
You got to remember with teeth, if there's nothing stopping the tooth, another tooth or a hard surface, it will keep going. So if we are missing our lower teeth, you will find on your patient when you look in their mouth, if they're missing teeth here, that these ones have just kept erupting and erupting and erupting and erupting, and they're a lot longer than the teeth that have an adjacent tooth to stop it erupting. Okay?
I
Yeah,
have
when
a
I say
wisdom.
kids, it's not good to lose them all very quickly and early. No. So they're all
Maybe.
falling out very early on.
No.
Okay.
Yeah. Similar. So an impacted tooth is a tooth that has actually, though, impacted onto the 7. So it's grown into the 7 and they're pushing against each other. It's causing root resorption of the 7.
And nerves.
Root resorption means the root is being eaten away by the 8, and that can cause problems for both teeth. And we don't want to lose too many teeth at the back there because we need them to chew our steak and our...
I have 2 wisdom
Chewy
teeth is hiding here.
You've got 2 impacted?
Yeah, in
Does it
here.
hurt?
Yeah.
Yeah.
My earache.
Earaches, yeah. Yeah, that's right. So they'll need to come out. So what's the word I'm looking for? If I just had a tooth I needed to pull out here, we just pull it out, don't we?
Mm-hmm.
What happens if it's impacted? What sort of...
Surgery.
It's a surgical extraction. So we're going to go through that as well. That's a surgical extraction. Has anyone... EXO is what the abbreviation we use for any extraction. Has anyone nursed for a surgical extraction?
Yes.
Tessa?
Yes.
Yeah? How do you find it? Yuck.
It's traumatic, but the
Yeah.
patient seems the patient's being looked after. And
Yeah.
they don't really.
Yeah.
They're quite relaxed.
The
about
person
it
is
and
numbing and
Yeah.
they
They are
don't know
numb.
anything.
Yeah.
Hopefully they're numb.
But I feel everything that we are just
Sympathetic pain. Sympathetic nurses.
And they
Okay,
cut the
so
gum.
when we do any sort of extraction, whether it's surgically opening up the gingiva or just pulling the tooth out, we use a special suction that's smaller called a surgical suction. We will not use the HVE because it's too big, and that powerful suction can promote bleeding, which we don't want, and it can also suck up a bit of tooth or a bit of gingiva and plumb up the works. And dental chairs are very expensive if you've got a piece of body stuck
Is that for
in your thing.
surgical only or normal?
Both. You should be using surgical for both. Yeah. I understand in some surgeries they don't supply that, but you have the knowledge now of why we don't.
have it in my one.
Yeah. Right, Marge.
Good evening. Thank you for participating. I don't know whether, or because we didn't explain to you earlier, that our students have to participate and conduct an emergency drill, which is normal in the workplace. In the diploma and advanced diploma unit that we deliver, they have to provide evidence of an emergency drill. So thank you and for allowing everybody to be photographed. Next week, the week after, the students will be coming back into class and giving a presentation on their role. As you probably saw, that there were many people participating in different roles, from timekeepers to first aiders to fire wardens, whatever it may be. They all had their position to undertake. which now they will be writing a report about. So it's really important that you understand it wasn't just for fun, it was for part of our students' participation and completed.
Well, it's good for us too because then we know in a case of emergency. We had a real one on our first day, our second day.
Yeah, and I got the blame for it. It wasn't even me.
Yeah, because Marge set fire to the oven.
Yeah, would you believe?
That's why I always joke when she's in the kitchen. I'm like, stop setting fires, Marge. No, a student used the oven, I think, and then they told Marge off for using the oven. She's like, why would I use the oven? Anyway.
But thanks very much, everybody. And it does happen if we run a drill, and it's happened before, that people won't want to participate. They'll go, yeah, it's too hot. Yeah, I'm not leaving. And we had trouble one time with some men working on a photocopier, and they totally refused to leave the work area. And I mean, Carol's been in this situation many times. Carol, haven't you, with fire drills? So she understands how difficult people can be. So thank you very, very much for your participation this morning.
Thank you. I'll just add quickly, we couldn't find Sonia. we looked in all the toilets.
Sorry, I'm the first one.
No, that's okay. Just if we do want to duck to the toilet or outside for a phone call, maybe from now on we just tell a friend. So if a fire drill happens for real and I say, where the hell's Sonia? Instead of someone staying back in the building and checking all the toilets, Nikita can say, oh, she's outside on the phone, and we can run out straight away and find her.
We have monitors that you may have checked, you may have seen, or some of you. In the male toilet, the female, our monitor stood with the door, with a foot against the door, so the door wouldn't slam, and the monitor went inside and checked all the cubicles. The same with the female toilets. The guy stood with his foot at the door.
Yeah, I think Nikita got stuck.
Yeah, I was in the toilet.
She's like, I'm in the middle of a wee. What am I supposed to do?
I noticed Sonia wasn't in the toilet, so I presumed, but I just think that she'd be down there where everybody else was. So in future, if this does happen in the real world, by the way, not here.
You have to remember.
Lovely. Okay, so does anyone know any names of extraction instruments that they might have come across in the workplace? Luxators, good. I think I got that out of Carol and Tessa. Luxators, what else?
Forceps.
Pryers, good.
Yeah, forceps.
And we have lots of forceps, yeah. So tomorrow we're going to learn every single one of their names and their numbers. So if your dentist asks for a 94, you know what to pick up. If he asks for cow horns, you know what to pick up. You won't, even if you don't get it tomorrow, I'm going to start that activity tomorrow.
With my dentist? He just grabs everything himself.
Well, you'll know it for the next one you work for. Are you going to work for Colin forever?
He's so annoying. He just does everything himself.
That's good, isn't it?
Yeah, but I need to learn.
That's because I think they've had.
OCD, right?
No, I think
Bad.
lots of dentists are like that now because there's such a lack of nurses. They've just had to, and then they're in the routine.
Yeah, because he's always on his own something.
Good.
Short stuff.
Is anyone squeamish with blood?
I don't know yet because I haven't seen it.
Right. I'm going to start with the worst one, which is a surgical extraction. So we're going to watch it. It's going to explain it with video and picture, and I will put this exact YouTube video up on Teams for you to watch and study later. Yeah? I might talk over and explain things as well.
Okay, well, what if you're in the surgery and you still have to be there, and then afterwards you eat your lunch? So what's different?
I'm not eating.
Then you
Alright,
get
hi
used
guys.
to it.
So today we're going to be recording a surgical extraction 3/8. Basically my plan for
Mine
this
is
tooth
like
is
this.
to raise a flap, create a buccal gutter extending around to the midpoint of the distal, put the section in right there, elevate out the crown, and then...
So we've learnt that
remove the
just in
roots.
radiography.
So
We could tell
obviously that's a
straight
very
away by
simplified
looking at
version.
that was an impacted tooth.
Yeah.
Done today.
Maybe
In
it's
this
my
extraction, I
surgery,
do
it
have
will
to
be like
section
this.
So that is a number
crown
4
more than
scalpel
just that
blade.
angle, I feel, because of the undercut that was in
And this
the
is the
teeth.
surgical extraction,
Yeah.
suction I was talking about. It tapers off smaller at the end.
Yeah.
Goes about
It also comes in blue, most likely to be blue.
Now I know what you're talking about.
Mesio buccal 7.
Yeah?
So just elevating that.
So this is called what he's cutting, a gingival flap. Okay, waiting for Tessa to giggle now. So when we cut a line there and fold that back, it's called a gingival flap. And we pull that back so we can see in there what's happening.
Can you see?
Okay, go then. Go
Now,
there.
if I was to draw it on the board, I'd draw a nice straight line and say we would cut a nice straight line. As you can see in real life, it becomes quite jagged and rough, and sometimes you hack a little bit. It's quite hard to cut through those tissues even with a sharp
So now I
scalpel.
start the buccal gutter, and that's roughly about 1 to 1.5 millimeters in width. I'm using a slow speed
Yeah,
electric handpiece.
So what he's
with a
doing
bone
now-
fillet, as I usually do for bone removal. Basically that gutter, as I said, will start from the mesiobuccal, extend out
The patient
to
doesn't have
the
enough
distal
blood.
tooth.
But I had a patient, they have,
In the
she
meantime,
has
More blood.
more
my
blood.
periosteal elevator
Patient might have been on
around
blood
extend
thinners or
the flap
something.
so that
Yeah, but-
the soft tissue doesn't get in the
And
way.
then how long it's gonna take to?
Maybe 1
My
hour.
vision is pretty good here. The angle that we're shooting.
I might have possibly at this stage as the nurse also had a mirror here to protect the tongue.
Yeah.
If it was me
I did.
personally,
I
this
did.
is making me nervous.
Yeah.
Yes, no space.
But
Have a what?
there's water coming out. This is a high-speed handpiece. It's got water. This is called a surgical high-speed, so it is hooked up to saline water, but there's water on it.
Smoothing off that bit of bone.
I sure can. Is that better?
Yeah.
But still,
Okay, so we're now ready to section.
So when we
Tooth.
remove a tooth that is
Here I'm using a
impacted,
45
we
degree
do what's called
NSK,
sectioning.
X
We
450
cut that into
Timex
quarters,
handpiece.
into 4 pieces,
It's got
and we remove a section
I think
at a
that's
time.
1
So
millimeter
any
diamond.
tooth that we remove that's inside or subgingival that we've had to do a gingival flap
Basically,
for,
we're
we
starting
section that
where
tooth
I
every
think
time.
Yeah.
close
Otherwise
to
it's
CJ
just
as
too
close
hard
as
and too
possible.
traumatic.
I like my first section
I did.
to also leave just either a slither of
You can see how
tooth
this
between
nurse
two
as well
roots
is
or
using
section
the
of roots as
suction
well.
To retract.
to retract. Yeah.
In this case,
But if she used
if
the
you
mirror,
go back
it's
to the
bit-
OPG, we've
A
got
mirror as
Yeah.
well, yeah.
Sometimes it's
quite
so
an
hard,
undercut
the
on the
patient's
7th.
tongue.
The
No matter how much
Yeah.
what is
it's
mesial
down,
Tongues are
tooth
powerful,
falls
yeah.
in quite well underneath that 7.
Yeah.
So, as you'll see here, I'm sectioning the crown off. Soon I'll begin elevation and then we'll go from there.
So what the dentist do with the high speed now? Is he breaking down the teeth?
He's cutting it, he's sectioning it, so cutting it into.
And then how long it's gonna take to?
No, it would be too hard to pull it out as one, but sectioning it and pulling out in the
Is
pieces.
that just with the molars or any?
And then after.
Anything
heal,
that's really.
One-
about 2 weeks.
one week.
Look, if you had the case
Yeah,
of
about
an,
2 weeks. So then you normally have a dry socket. And then put
get
the,
out.
the gauze.
more painful.
You
Yes.
can't eat
So
anything.
to stop the dry socket, you put that gauze that absorbs the gauze inside.
Erupted or impacted?
They say 2 weeks for it's 1.
Yeah.
Some people,
So this is just if it's impacted.
one.
So the only time we would cut a molar up into 4 pieces if it's subgingival, under the gum. It's impacted. It's down there. We've cut the flap of gum, opened it up. Oh, hello, here I am.
Okay.
And we've cut it into
So
4. If it
I've
was a
got the
tooth
thin
already
slither of
out,
enamel on the
we
lingual.
wouldn't do that unless it was
As you
very
can see here,
broken
no
down in
apical
special
pressure whatsoever
circumstance.
on the root, but just
So now he's using the luxator.
and
yes.
I was very happy when to discover.
we've got it there. and
Yeah.
it's not moving much further than that.
And he
that's
uses
because
a
of that
wedging
cusp
action.
tip trap done
He is
57.
to.
So
Mary's
one option
shadow.
here is to remove
Wedge
the
shadow.
molar. I prefer
No, that's
not
not
to
the
do that.
toothbrush.
I'm basically going to try to remove that bit of tooth with a pair of artery forceps or needle holders.
I was going to say, they're not. I don't
No
know.
good
Yeah.
there either. So you can see a bit of movement, but still undercut.
He might be
Yeah.
sectioning this in 2 actually. He might be sectioning this one into half.
Yeah, it's breaking bits, yeah.
So I'm going to move
Again,
separate the crown into symmetrical halves.
Again, I wouldn't be using a high speed,
And
a
I do
HVE, because I
begin
don't
with the high speed.
want that.
Is it a flathead bird?
It's a surgical burr.
Basically, that
Yeah,
bit
we'll
of
go
tooth
through
is
the
lodged in
surgical
there,
burr.
and we're just sectioning it enough so I can get an instrument in between those two halves and just split them.
Yeah.
So he's doing it into quarters, which I recommended in the first place.
That's not a bottom, that's a upper.
You didn't know
That's upper.
Is this
The
the upper
nose,
one?
yeah, the nose is here, guys.
So
Yeah,
this time, we'll
it's
just
upper.
Yeah, that's
Yeah.
upper, yeah.
lock cedar in
That's the
and
worst place.
The
ever.
3/8.
That's the worst place. It's in, down is better,
Oh.
even for section.
there you go, that's gone.
Something I like to do for my patients, and you may have in your surgery, is some Vaseline or some lip balm.
Oh
Yeah.
yeah.
And we
Yeah.
put
So
that
now
on
we're
the
gonna
patient's
remove
lips
Yeah.
before something like this, because we're really stretching
The
them.
distal
Yeah.
And we're
so
splitting
the
dry
lip
lips,
that's
and we're
obviously
making it a dry
more
environment with
correctly
suction
positioned.
and everything.
And you can see that comes out very straightforward.
Now
It's
we've
just a
changed to the
small
the
elevation. There's a slight
surgical
curve on the
suction,
roof,
so we
but
don't suck that up
it's
and
not
clog up our
difficult to
dental chair.
negotiate. Deliver that, and the other one's quite loose in the socket to the point where we can just pick it out.
So he's just using tweezers now. He's loosened it enough.
Oh, okay. Yeah.
Marcado, mira.
So it's all out. Now we're just going to put a stitch in, close it all up.
So now we need to suture that flat back up, okay?
And the type of suture would be dissolvable anything.
So this is a dissolvable
It is
suture, this
dissolvable.
one. This is not
Yeah.
silk, this is a
As
vinyl
man
suture.
Mama mami. Sakit ka ba rin? May pa na.
So the nurse's role, she's retracting the tongue,
Oh yeah.
because we have to use the dentist will have to use quite a bit of area to suture. And he or she, the nurse, might also have some scissors and will cut for the dentist. Sometimes they do it on their own. Most of the time we will cut that for them. Sutures are quite fiddly and require, there we go, gave it a cut.
Oh, that's better.
And you can see there it's come together well.
There's
And the
sections
front,
too.
as well as the crown of the tooth. Thanks very much.
So that
They're
was
gonna break that?
a,
Or
Yeah.
it's break?
No, that's a break.
They use the high speed.
Break this?
Yeah, they had
so that is a more, I've shown you the most extreme one first. So that was quite a clean and easy surgical extraction. We knew what was happening.
Clean and easy. That was not a clean and easy.
So we knew what was happening.
Yeah, it was.
What?
We knew what was happening. We knew that we had to section it. We had everything ready. Another way it can become surgical is a very broken down tooth. So a tooth that is very heavily decayed. We go to take it out and the tooth just crumbles with the force. And that is where we are picking bits of tooth out the gum, and we'll learn about what instruments we use in those instances tomorrow. So let's just quickly go through some of the PowerPoint before we have lunch.
Kylie,
Everyone's
I don't
ready?
know which force I have to choose. Like,
Yeah, that's
if
going
this
to
is in the anterior, which force I have to choose?
I'll go through that tomorrow when we do that lesson. You guys will be amazing.
Because it's a lot.
Yeah, there is. There's a lot to choose from.
I don't know which one.
Integration.
I'll make it easy like I've done everything else.
Aura training. Mas diga que não
No. You jam kita.
nada de
Jam ka.
Okay,
Just wanna try it.
So reasons we might take a tooth out, obviously, severe caries. It's just not viable to patch this tooth up because, as you know, we can't just add an entire crown of composite. It's just going to fall off. So yeah. Periapical infection. What does that mean?
What?
Yes. So a really bad infection with the root canal. Periodontal disease. So periodontal disease has eaten away at the bone structure and the gums, the gingiva so much the tooth is flapping in the breeze. And it's just not something we can save. So it's easier to pull it out. and look for a different solution. And it's also probably promoting the disease at that stage. Part of orthodontic treatment, I'll come back to that. A fractured broken tooth that cannot be saved, which means it has fractured quite low. Even with root canal, post and core, we wouldn't be able to save that. Severe erosion, attrition or abrasion. So as I've explained, if once your enamel's gone, there's not much we can stick to your dentine. Dentine, we can't stick things to. So that as well. And impaction, which we just saw. Now going back to orthodontic treatment, that is the only ethical and legal way we can take out a healthy tooth. Okay? The only way, with an orthodontist referral. We can't decide, dentists can't decide in the chair, oh, if I pull them out and then I send you the orthodontist, they could close those gaps up. The orthodontist has to have it part of their treatment plan. Now, does anyone as old as me remember the show Ricky Lake?
Oh,
Go
yes.
Ricky, go Ricky. Yeah, that. Anyway, younger people, it was like before Ellen. But she had like really interesting guests that thought they were vampires and things like that. There was one show about people who actually had a condition where they wanted their teeth pulled out. They wanted it, and they were in America. They were in, court or whatever, trying to fight for the right to get their teeth taken out because it was their fantasy and they wanted it and everything else. And I watched that as a kid and I still remember it now. But legally in Australia, we can't just pull a tooth out because someone says, I don't like that tooth. Okay, there has to be a clinical reason, or an orthodontist has said, yes, we can take that out. I don't have upper fours. They took my fours out for my braces, for example. Patient's wishes, don't listen to that. Patient's wishes, I'll explain. So cost of the root canal is too much. If your tooth has an infected root, you have two options, root canal or extraction.
Oh, yeah, that's
The longer you leave a root canal, the more it's going to hurt and get infected. If you don't have the money for that, unfortunately, most people say, I'm not paying $1,200 for this tooth, plus then another $1,400 on top of that to crown it. Just take it out. You will get patients like that.
Yeah.
Why root canal is expensive?
Root canals are expensive
Yeah,
because the
time.
materials we use are expensive. Our time's expensive. Yeah. Patients' wishes, so that would come into that, not because they've come in with a healthy tooth and said, I just don't want it. A failed root canal, which we talked about on the previous page. If we've root canaled a tooth and it's failed, there's not much we can do. Okay.
How can it fail, Kelly?
There's lots of ways a root canal can fail. We can take the x-ray at a funny angle and we'll see that there's a hidden root. Some teeth have more roots than they
That's
should.
what happened with mine.
Oh.
She took out 3, but then later found that
There was a
another-
fourth.
Yeah.
Oh, you're
Which
lucky.
was unusual.
Sometimes the root does this, and on the x-ray we see this. So we've cleaned out this part. There's still an infection there.
Yeah.
We can have an endodontic file that has got stuck and broken off quite low, and we can't get it out. So that tooth has to come out. Overerupted tooth damaging opposing gingiva, that again would be an orthodontic decision. And a retained baby tooth. Carol, do you want to share your beautiful story?
Yeah. I had the experience of we treated a 24-year-old male who still had 7 of his baby teeth, and most of the teeth were quite eroded because baby teeth are quite soft, and so being an adult, the bite force that he uses when he's chewing food and all the rest has caused the baby teeth to just be crumpled and worn away. And eventually with this particular patient, he may need, most of those baby teeth will need to be extracted, and he will have to wear bridges or implants. So by the time he gets to about 40, he needs to decide. He will most likely lose majority of his teeth. They just never his permanent teeth. No, they're not anywhere present in the X-ray. They just were never erupted, and so he has babies. 24 years old, still has baby teeth.
Parents not bringing him in to do it.
Even if they had,
Yeah.
the treatment plan wouldn't be any different, unfortunately.
Mm.
Yeah.
So his oral care could have been better.
Well, baby teeth aren't designed to last 24 years. They aren't designed to last 40 years. So even if he was great at oral health care, there'd still be a failure rate for sure. Yeah. You find in this case, those teeth are kind of a mix between a baby and adult tooth. They definitely have longer roots than what a normal deciduous tooth would have, but not sufficient enough to last the whole life like an adult tooth would. Does that make sense?
So is that genetic from his parents, or is it just?
It is a genetic condition. So, yeah. So I remember having a patient, not 7, that's amazing, who had a couple, and then one of her children also did not have some of his permanent dentition erupt. Yeah. So where it could start, and we're talking about with the X-rays, genetic and somatic conditions. This would be a genetic, obviously, condition because maybe great-grandma was born quite prematurely. So therefore, she missed the stage of tooth buds and she didn't get those teeth. And now it's just being passed down genetically through the generations. Okay?
Everything's genetic.
Yeah. So that's how little things like that happen. Interesting, I'll chuck this on, not really much to do with exo, but the most common teeth that people are missing are the lateral incisors. That is probably the most common. If you're going to if you're missing teeth, there'll be a lateral incisors, and most likely one of your children will too.
Because Lucas has that little, when his front one was coming forward, it has like a little chip in the middle.
Okay.
So I thought it was 2 teeth coming down. So when I go to the dentist, they're like, luckily he has his one, but it could have been 2 fused together, the big 2 teeth.
Oh.
Because he's got like a little chip in the front.
Interesting. Cool. Yep. Or peg teeth as well, which is that's where you're going with that. Okay, taking a medical history is vital, obviously, because if your patient is on blood thinners and they've come in and you want to do an emergency extraction because they're in pain, we can't do it that day. So we would most likely send them home if it was an infection with antibiotics and get them to contact their GP and say, what's the safe amount of time they can stop taking their blood thinners because we need to extract a tooth, okay? Because they could potentially bleed and out. And it will become an emergency situation, especially if we go to pull it out and it turns into a surgical situation in our chair, and then we're causing more trauma, therefore more blood. Okay. Now, leukemia patients, patients who have a pacemaker or a heart valve. What does it say? There's a picture. Out the way. And any blood disorders and diabetics need to have antibiotic cover, okay? However, in a very severe emergency situation, we may not be able to, but that is your dentist's call. Antibiotic cover will be taken usually 24 hours before we schedule the extraction. So diabetics, 100%. Chemotherapy patients, if they've been on chemotherapy for a long time, most likely will need extractions. It severely damages the tissues around their teeth and we can't save them, so they go through a lot, but we just need the antibiotic cover as well. They are more susceptible, these sort of patients, to infection, okay? And quite severe infections. Their body does not heal as well as a healthier person. Oh, I don't care about the viruses. Go away. Okay. Oh, I know them.
COVID vaccine. You medic
So we will never, ever, 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 ever take a tooth out without an x-ray of it. Okay? We need to see what's going on subgingivally. We need to see if there's an extra root. We need to see if there's a hooked root. What else would you need to see, Carolina? You would know more than me. What do you look for on the PA to be able to take out a tooth? Yes, infection. Yep. Yeah, no, that's a good one. So if there was an infection at the apex there, we would need to antibiotic cover because we'll pull it out. Pulling out a tooth that has an apical infection, I actually find really cool, but I'm a bit warped. So the pus actually goes really hard. It's like a big white ball, and it rips out, and it's like.
Oh, I want to see one of those. I haven't seen that.
It's cool. So when there's a, so say we've got a, oh my goodness, everyone's making me draw again. There's my tooth, and we've got a really sore. Oh, that's not red. That one is. So this is all sore, inflamed, and there's a big infection here. What does it look like on the x-ray, that infection?
Nothing.
Good. There's a black shadow on the x-ray. So we know there's pus there. We know there's pus there. Okay. Now let's pretend it's all cracked here and they've left it. So this patient has got through the pain, hates going to the dentist, and has just got to the stage where there's nothing we can do. Like, that's calcified. The tooth's dead. They've lived through the pain, but the infection's just reoccurring. And then when you pull it out, you pull out the tooth, and attached is this big, hard, white lump.
Will it always be attached?
Like yeah, I don't think I've had one that's not attached. Yeah. Anyway, I find that really gross and cool. And it leaves a big pocket down there as well. Okay. It's almost like you've pulled out, I'm going to gross everyone out here. You know when a chicken, the white fatty bits, when you cut up a raw chicken? Yeah, that's what it's like.
Okay.
It is cool.
Yeah.
And if anyone's going to faint, let me know.
Like, is it all?
Yeah, and then they will use what's called a spoon to scrape in there. Pardon?
Did you have to use
chicken?
I know.
Chicken. Now I'm not eating chicken.
Has anyone ever got chicken for lunch? Also supernumeracy. So
Yes.
so people have extra teeth. Again, orthodontist decision. Okay. Shark teeth. Obviously, we talk about the cost of things before we do any procedure. Okay, so can I have a volunteer? Sonia, you can be my volunteer.
Yes.
So bring your chair here. So Sonia is my patient. Are you okay if I touch your face?
Yes.
Okay. Just move forward a bit.
Okay.
All right. When we pull out, sit down. When we pull out a patient's tooth, it's hard. It's hard to pull out a tooth, even one that needs to come out. It's hard work. Get muscles, Carolina. It's hard. I actually have worked. Were you good at it? Yeah. Yeah. You have to elevate, pull. Elevate. Yeah. I've worked with female dentists, not to be sexist or anything, that are about Carolina's age that actually refuse to do them because they say it takes too long, we can't do it, and send them to the bigger guy down the hall.
No, there's this lady, Aman. She is like the best I've ever seen her getting teeth out.
Yeah?
She does it so easy.
Yeah.
Like easier than what a man would do it.
Yeah. It's not necessarily man or female. It's just it's a workout. It's a workout. It's a workout, isn't it, Mumta? It's a workout to pull a tooth out. Get big muscles. Yeah.
The other place it's like a little bit easier.
Yeah.
Because they do like
some are better than others.
different tools.
Yes, we use all the tools.
They don't care about patients.
Okay, but because it's hard to pull out, what do you think happens to our... I just sanitize before I touch your face. What do you think would happen to the patient if we're going...
Freezing.
Yeah, head.
Yeah. Sometimes I. Yeah.
It's if you ever work for an oral surgeon, you'll be traumatized for life because they're under GA and we just don't care. We just want that tooth out. But anyway, when they're just under LA and they're quite conscious, we do these special holds. This is the nurse job. So the dentist can have a good grip and have a good wiggle.
Hold the head. Yeah, me hold.
Warm my hands up. We hold where the TMJ is here and put our thumbs on the temple and we hold firmly. We're not holding so tight that they think their head's going to explode. I'll just move my camera around for the people at home. No, they're actually turning the power off, so we wouldn't be able to even leave the building.
Can we see it again, please?
Oh, sorry, thank you. Yeah, I'll do it again. I'll just move the camera for people at home. Yeah. So we would hold here on the TMJ, and put our thumbs on the temple, and we would hold firm but without causing them stress. And if the dentist is pulling this way, we would put more pressure on this hand here to keep it aligned. That also stabilizes the tooth, so the tooth wiggles and not the head. Okay?
Yeah.
Now also the neck can also tense up. Naturally your patient's going to go, oh, I have to keep my head still. So sometimes in between I would just use my thumbs and just give and I would just give a little bit of rub there between. Okay, while holding here.
Oh, so just do the head massage.
Yeah. Oh.
At the end and then pull the head off.
Did you say you're gonna pull? You watch too many movies. So there we go. Does everyone want to practice on the person next to them?
Yeah, massage me.
So we want to hold along the jawline here. This part of my hand is supporting the TMJ. Why do I keep saying TMJ?
Am I right?
TMJ, yeah, and then on the temple here.
I'm waiting for the massage.
Hand sanitizer.
Yeah, hand sanitizer. Good idea. Sorry, Ryan. If you want to sanitize before you stick your hands on someone's head, they go. Do you want to do Rayora?
Keep going. Keep massaging.
Yeah, I'm like,
Have a practice supporting your patient's head. Yeah, good.
Scary.
Are you okay with me? Yeah?
Sure.
Did you have your nurses do this? Carolina, did your nurses do this in Argentina? Hold the head?
In Argentina, but here in the clinic,
Yeah.
the doctors say me, I am doing like
I want to hold their head like this.
yeah, but
Good job.
new technique for me.
Now tell the person holding your head whether it's too tight or you feel they can go firmer, and then you'll feel when they're holding your head as well. Good.
Oh my god.
It's good. I'm done. Pardon?
I'm done. Someone
Yep.
spells me. I need someone spells me. Oh.
Yes.
Oh yeah.
What is that?
Yes, we have Shana on campus.
I think she's going to hurt you.
You know. I'm going to try it. Okay, go.
I didn't know how to hold it. And I could tell the dentist was a bit annoyed. I'm like, well, I don't know how to hold it.
Sana! No! Sonia was like, oh my god.
Let's not do this.
I thought Kara was very brave choosing Zana as a partner. Okay, good. So if it is a tooth that requires a lot of that, some of you have mentioned your operator will say, can you support the head? In that case, they normally grab the suction as they need, okay? So it leaves you free to do that. Okay? Or if it's a really traumatic type thing, you normally get what's called the second nurse, okay? Or the scout nurse. So the scout nurse would be holding the head or going to grab the instruments while you sit there chair side and suction and help, okay? And retract tongues or whatever else you need to do. What else was I going to say about holding the head? Always make sure you tell your patient what you're doing before you grab them around the face, please. If you sneak up behind them and go, hi, they might think you're cracking onto them.
I had this old patient yesterday, and she said, "Oh, there's so many of you in the room," and I said, "I'm training," and she goes, "Well, please don't hurt me." I was like, "Oh, okay."
I should have gone, "Oh, leave then."
I'm not a dentist. I'm not going to touch your teeth.
I'll try.
Yeah, but I'm all lady.
Yeah.
I won't date you.
Yeah.
That's all right. Some are funny. Yeah. So I wouldn't walk up behind Louisa, who's scared and is about to get her tooth out. Because she might go, what the hell, you're holding my head. Okay? And your operator will always give you gaps as well. You and the patient time in between, and they will need a break too. Okay, after we take the tooth out, we need to check that we've got all the tooth out. We haven't broken off a tiny bit of root or something, so we will use an instrument to go down there and give a bit of a scrape. We also do that for another reason. We want to now promote some bleeding in the socket. Okay, so now we've got this empty socket. The tooth is out. Now this is a straightforward extraction. We don't need sutures for this one that I've done now. So now we've just got a hole that looks a bit like that. Okay. We want to put something sharp like a probe down there. Okay. Scratch it up a bit. We want it to fill with blood. Okay. We want it to fill with a little bit of blood. Because that is the probably that looks dramatic, but it's a little bit of blood. Because that's our body's natural way of healing. That blood will then clot and it will heal the socket. Okay, once we've done that, we get a piece of sterile gauze. What is sterile gauze? Good. Gauze that has been through the autoclave in a little packet. We'll open that on the tray and the patient will bite on that. While the patient is biting on that, that quite soaks up with quite a little bit of blood, okay? And that's when the dentist will usually do their notes and you've done a bit of a clean. After about 3 minutes or so, we will replace the gauze with a new one. There's normally 2 in a packet, your sterile gauze, and then we'll give them a packet that's unopened for them to take home. We tell them the second one, they must bite on that for 30 minutes. Then, if they take it out, with some pressure, not so they get, a jaw ache, but with some pressure, just like if your arm is bleeding and you put pressure on it, it helps the blood clot. Okay? If they take it out after 30 minutes and it's still bleeding a little bit, we've given them some spare to make them feel better to bite on it longer. If it is still bleeding an hour or 2 after that, enough that they're worried, they must ring us straight away. So we say, please ring us straight away. There's a reason. There's a medical reason. Okay? Then we will do a special thing. And then if it's still not bleeding, then we send them to the GP.
I had my wisdoms out, and then when I went home to take the gauze and stuff out, it was like all with blood. It was so gross.
Yeah, it's a lot of blood. Also, how do we keep this blood clot in? Our patient is not to swish water or rinse for 24 hours. To keep that blood clot in there, we don't brush the area for 24 hours to keep that blood clot in there. We don't smoke for as long as possible. Now, it's very hard to tell a smoker, please don't smoke for 24 hours. No, I didn't actually. I'm scanning the room. Guilty conscience. Yeah. It's very hard to tell a smoker please don't smoke for 24 hours. We say please go for as long as possible. Another thing that can dislodge the blood clot is alcohol. As tempting it is after an extraction to go home and have a glass of wine, it actually thins the blood, and then the blood isn't thick enough to clot. Okay, so you will lose that clot. Smoking, drinking, exercise. You may have a gym class at night at 6 o'clock that you've not missed for 4 years. Oh my goodness. Exercising thins our blood, and you can lose that blood clot. So take it easy, rest. What we want to do starting the next day or 24 hours later is some warm, salty mouth rinses. A teaspoon of sea salt into some warm water. I tell my patients to pop it in their mouth, hold it over the area until the water has cooled a little bit, and then expel it into the sink. And I want them to do that after every time they eat and before bedtime for a week. Okay? Now, what happens if you lose the blood clot? Who knows what happens?
Dry socket.
Dry socket. I have heard that's the most painful thing in the world. I've never had a dry socket, but I have had growing bikies come in and just be like, kill me.
That's how I found out I had a high pain pressure. So I got 4 wisdom teeth removed, and I had 4 dry sockets. And I didn't even know, didn't feel a thing.
Okay.
So dry socket is where the blood has, for whatever reason, you haven't followed your instructions or whatever, and you have nothing in there. No blood, no clot. So what happens is it starts getting infected, and it gets filled with pus and sore. You may have a bit of food that got stuck in there.
So it doesn't heal?
No,
properly?
it doesn't heal. It's an infection inside the socket. Okay, so the patient comes in going, oh, a kind dentist will give them some LA. Okay, give them some LA because they've probably been in pain for a little while. Just to give them some relief. We will get our probe or sharp instrument again and we'll make it bleed. And then we have this material which is made from an Indonesian plant. It's the only where it grows in the world, and it's called Alvagel. We'll play with that tomorrow. It has Alvagel. Yeah, it has a very distinct smell. It has cloves in it as well. Okay, so it smells. I like the smell. It smells like a dentist. You'll smell it and be like, that smells like a dentist. We grab that and we pack it in after we've made it bleed, and that will cause them some relief and will also help the infection. They bite on the gauze, they go home. Okay? We may ask them to come in the next day to have a look, but usually they're okay. And we will also send them home with a script for antibiotics. Okay? But it's very important to say in your post-operative instructions how painful and awful this is, so they follow their post-operative instructions. It's very natural to go home and go, I need to swish it with Listerine so I don't get an infection. It's actually not helping, it's causing a problem. Or to get a kitchen utensil and dig in there thinking, I want to make sure there's no food in there. Oh, you'd be surprised.
So you can't eat and drink for 24 hours?
No, you can eat and drink. Yep, just on the other side.
Oh, okay.
We just want to swish around the way. But that comes to my next post-operative instruction. What sort of foods do you think I'd ask them to avoid? No, what food do I want them to avoid?
Avoid hard foods. Yeah.
Spicy.
Don't go eating a piece of steak or something.
I mean, you can eat all of that stuff if you eat on the other side. What about rice? Do you think rice is a good idea to eat?
No.
Little bits of rice.
No.
Yeah. Bits of rice, I say to avoid rice. I would say avoid spicy food in case it hurt, in case some went over there. Shredded meat can get caught, like tuna in the cans. I'd say, look, avoid foods like that because it's just, even though we say eat on the other side, it's most likely going to end up in the socket. Okay? Any questions?
No. But you know when you eat on the other side, aren't you breaking it down anyway? And it will go to the other side. You know when you on the other side, you're chewing and it breaks it down?
Right, so we won't go through forceps because we're going to do that tomorrow. Any questions about what we've covered so far? What LA would I use if it was a 3/8?
Articaine long.
Good. And what's that called?
Articaine long.
An articaine long. And what sort of?
It's a block. It's
Block.
A complete
Good job.
block.
A block.
Yes, yeah.
So what if I couldn't use adrenaline because they were a diabetic patient?
Okay, so then if the patient's nervous.
Yeah, so I can't use adrenaline.
No.
Xylocaine. Yeah, good.
Yeah.
Good. What LA needle would I use for a 1/1?
Short. Lignocaine or articaine short.
What X-ray would I take of a tooth to before I pull it out to make sure I can get all the anatomy correct before I go digging in there?
PG.
PG?
No.
PA, good. Which stands for? Periapical. Good. And that way our operator can see what's happening underneath before they go digging in there blind. Okay? What would you say to your patient if they said, no, I don't want another X-ray? No, you take too many X-rays off me.
It's essential.
It's needy.
Yeah? Why?
It's important because I want to see.
Yeah, what's happening in your teeth inside.
Yeah.
If we don't take
Say,
X-ray,
look,
we don't
can't
know.
take the tooth out without an X-ray. We need to see before we go digging in there blind.
Yeah.
Do you think
Just what I said.
they'll tell you?
Oh, I've had that. Yeah, you get difficult.
No, some patients I don't want because last year I did the X-ray. Why you want to?
Yeah.
This
I did an X-ray 3
Yeah,
years
yeah.
ago. Why do you want to
Yeah.
take another one? I don't know, because I'm bored. Like, yeah, I'm just bored and I just want your money. Like, oh my goodness. Right, that's probably a good. What's the time?
12:30.
Let's have a break. Pardon?
12:39.
12:39. It is time for a break.
Yes.
Hopefully no one had chicken. I'm sorry. And I'll see you in. We got to leave at 2 today. So how about I see you in 30 minutes?
We're leaving at 2.
2:30. Sorry, we're leaving at 2:30 today.
30 minutes?
Yeah.
Okay.
So
2:30.
what did you say the time was? How about 1:15? We'll be back here at 1:15. It's 12:40.
On
Yeah.
Google, you can go on Central and then go through.
I do have the something up.
Turn our lecture off.